Hello, I'm here with Dr. Marilyn Lahey, a family practitioner at the Group Health Center in Sault Ste. Marie and Chief of the Family Medical and Hospitalist Program at Sault Area Hospital.
I have a practice of about 2,000 patients in Sault Ste. Marie, of all ages, newborn babies to the elderly. I have office hours from about 9 in the morning till 4:35 in the afternoon. And then once about every 6 weeks, I do a rotation in the hospital where I look after my hospital patients as well as patients from other practices. I think the best part of my job is that every day I have an opportunity to see patients that I have been with and have been with me for a long time, 15, 16 years in this practice. And I know them well and they know me well, and I can continue to provide medical care for them with things that come up throughout their life cycle, and just serve my patients. A typical day would be I would go to the office early in the morning, and I would probably answer some messages from my nurse about patients who've called in in the previous day or early that morning about some medical problems that they have. Try and sort those out whatever way I could, whether it's putting in a prescription for them or having them come into the office to see me, or giving them some suggestions over the phone. Then I would start to see my patients who were booked for that day, and I'd see about one every 15 to 15 minutes. Throughout the morning, I would probably get more messages from my nurse dealing with patients' concerns. I'd also refill prescriptions that have come in through the electronic prescribed system that day. Call specialists if I needed advice, make referrals to specialists or to other paraprofessionals like physiotherapy or occupational therapy or chiropody, or for home care for patients that I see. Answer questions about issues that come up with family practitioner concerns at the hospital, or with hospitalist concerns at the hospital, and basically do that all day till about 4:35.
Okay, what do you like most about your job?
I think I just like seeing the patients, looking after patients, dealing with their medical illnesses, trying to sort out what's wrong with them, help them get over it, dealing with patients when they're in difficult situations, or just for simple things that I can offer quick fix for, helping them to prevent disease and giving them advice to generally stay healthy. So I think it's the actual patient care contact that I like the most. When I was in high school, I really enjoyed the sciences, and then when I was in university, or when I started university, I really didn't know what I wanted to do, but I enjoyed the idea of doing something in healthcare, because I think at that time I was somewhat idealistic and I wanted a job where I was serving other people. And then I decided that to go into medicine, I would have the most autonomy of any of the other areas in healthcare that I was aware of. I wanted a lot of autonomy, and I wanted the ability to have a job that I could basically be my own boss with.
Yeah.
I think the most challenging part of it is just the overwhelming volume of work and the overwhelming demands. Particularly in the north, but I think everywhere in Ontario and probably Canada nowadays, the expectations from patients and the medical science has advanced to the point that we're really able to offer patients a lot of information, a lot of investigations, a lot of forms of care, and it's just overwhelming, the number of patients and the amount of work that each patient requires, and there's just never seems to be enough services available for them. If you are interested in science and enjoy science and want to pursue a career in it, it's really, really important to, first of all, believe in yourself and decide what you want. And I think in order to achieve what you want, you have to really want it very, very badly. If you have a strong desire to achieve something, or if you have a strong desire to pursue an area in your life, no matter what it is, science or anything else, you have to want that more than anything. And I think if you have that desire there, you'll be able to achieve it. It requires a lot of hard work. The sciences are not easy. And I think a lot of the programs in science are fairly competitive to get into, so you need to have good university marks or good high school marks to get into them. But I think anybody who's interested can do it. You just have to be willing to commit and work hard and just be willing to put everything into it to achieve your goal.